My name is Caitlin McClain. I am from Boston, Massachusetts originally, and I currently live in Illinois, and I am a C. diff survivor. I know a lot about C. diff because I've worked in healthcare for 15 years, and I have treated several C. diff patients, and I have always been really careful and diligent about wearing proper PPE to prevent myself from contracting this infection and from preventing it spread to other patients and other personnel in the hospital. I was diagnosed with acute diverticulitis in the spring of 2024, and it was recommended that I start a course of antibiotics, 2 antibiotics actually, to treat this infection. At the time, I asked the doctor if this was the standard of treatment, and he said that it was. And unfortunately, taking those 2 antibiotics led to C. diff. I had symptoms for the entire summer, but I was not formally tested for C. diff because my primary care physician felt that I did not meet the criteria for testing, meaning that I wasn't an at-risk population. I did not live in a long-term healthcare setting. She felt that if I were to have C. diff, I would be doing significantly worse. And the diarrhea that I had initially was more mild. And I also have some other GI diagnosis. So they felt that it was related to that. In August of 2024, I presented to the emergency room with sepsis, and that led to the formal testing of C. diff. And I already knew that that's what I had when I received my results. I was terrified because I did already know that most patients have a high rate of recurrence, and I am allergic to vancomycin, so unfortunately that left one antibiotic for me, which was Difficid. I am really lucky because I have health insurance. I think I received a statement in the mail, and one 10-day course of antibiotics was over $6,000, and thankfully my insurance paid for that. I also was very lucky because I had a GI doctor already, and she is very knowledgeable about FMT, Dr. Melissa Martinez. She knew pretty much immediately that I probably would need an FMT done. And at the time, OpenBiome was able to distribute stool to my local hospital. And so I completed 10 days of antibiotics and had an FMT. And unfortunately, it was not successful. And so they repeated antibiotics and then repeated the FMT. And I had a resolution of symptoms for a few weeks. And then, unfortunately, the symptoms recurred, and I had a third and final FMT done at my local hospital. At that time, OpenBiome had already announced that they would no longer be able to distribute any more stool to hospitals past a certain date. And so I had a very hard conversation with my doctors about how I was running out of options if we couldn't get to a higher level of care. And it's really hard to face your mortality at 36 years old. Or 30, I was 35. I'm sorry, I was 35 at the year. I just turned 36. I have 3 children. I have a partner. This was very hard for me. Thankfully, I was then referred to Dr. Monica Fisher at IU in Indianapolis, and she has been doing FMT for several years. And I was able to receive another FMT and VOWST at that time after a very prolonged period of Difficid. I was on Difficid for 8 weeks. And although I did not have another positive stool test, I was still extremely symptomatic of the infection. And she then referred me to Mayo Clinic, where I met Dr. Sahil Khanna. He's a wonderful person. He is very knowledgeable about the microbiome. Mayo Clinic has resources that other hospitals do not have. And the thing that really helped me the most was just who he was as a person. He didn't see me as a patient with an infection. He saw me as a complete person that wanted to return to my life. And so I had a 5th and final FMT done there with stool from their bank. And thankfully, I have been C. diff free for 9 months. And I'm very, very grateful for that. But I have inflammatory bowel disease. And so I have had some issues with that in the past year. As Trish mentioned, she struggles to eat a lot of foods. I also struggle with that as well. I have to cook separately for myself as I do for my family. I don't enjoy going out to eat. I don't even attempt. And I've lost a lot of weight over the past year. I lost a total of 68 pounds. I am still dealing with vitamin deficiencies, fatigue, ongoing post-infectious IBS symptoms, which unfortunately mimic the symptoms of C. diff. So every time I experience those symptoms, I panic. And that has not resolved yet. I don't know how long it will take for me to feel secure in where I am in my health journey right now. The thing I think that I really want people to take away from my experience is that FMT is completely safe and it is effective, even in patients where it has to be repeated. And I am that patient. I have an immune deficiency, and I did not know that until this happened. But they were a little bit puzzled why I was not doing better after 1 or 2 FMTs. But the reality of the situation is I am better, and I'm still alive. And I'm alive because of Open Biome, and I'm alive because of Mayo Clinic. And patients deserve access to this treatment, and we need to find a way for the FDA to allow for that. VOWST is a wonderful tool, and Rebiota is as well. And I think that Rebiota would be more effective if delivered via colonoscopy instead of through enema. And we still have pediatric patients that are being affected by C. diff. There are roughly 20,000 children that will be diagnosed with C. diff in the next year. And a lot of those children will have recurrence. And right now, there's no other approved treatment for them. So they really need FMT to be back on the table. And the other thing I want people to know is that this infection, it really takes everything from you. It is disgusting, and it is undignified, and it is terrifying. And it's not uncommon. I have learned a lot more about C. diff than I ever thought I would know. And I realized that I am one of several young patients. I am not rare. C. diff is not rare. And everybody needs to know that this is a possibility, even from one course of antibiotics, which is what happened for me. And my hope is that as more information becomes available and we share more of our stories, and the wonderful doctors and scientists that are working so diligently to help treat C. diff and prevent C. diff, that they will work closely with clinicians that are treating conditions so that they pick the most appropriate antibiotic only when necessary for the patient. So that's just it's a little bit of my experience, and I really appreciate the opportunity to share.
Well, thank you so much for sharing, Caitlin. We do, if folks have maybe a question or two for you, we can get through, but I do want to thank you so much for sharing your story. Even though I personally have not had C. diff, as you know, I lost my mom to it, and it takes a lot to get up and tell these stories over and over again. And you said a lot that I agreed with, and there's a chat going on about like why Bezlo isn't available anymore, and some think it's because they were doing it only in infusion centers, and if you got it at the hospital, they wouldn't pay for it. And there's a lot of these things that you experienced, and we've heard, from Trish earlier with, not being able to get the drugs that she needed, that I just think we really have to take on, which is like patients need to get the drug that their doctor thinks they need.
Very much so.
Without this jumping through hoops and red tape and who has a deal with who and go to this place and not that place. I mean, because to my view, because I try to have this 30,000-foot view, it's not just that it's impacting you as a patient, that obviously we're always trying to think individually about every patient, but also it's impacting, if these drugs are not used, then they go away.
Correct.
And then we have fewer and fewer options. So that's something that we're very interested in looking at. I think you stunned people with your story, so we haven't gotten any questions. But I'm sorry for what you've been through and continue to go through. But I'm also very, very grateful that you became one of our volunteers, and you have a ferocity that I enjoy because I also share it, even though I think I might be a little bit more smiley on camera.
You are.
But it's all an illusion to lure them into what I want them to do. So thank you so much, Caitlin. We really, really
Thank you
do
so much.
appreciate it. And we're going to keep pushing. We're going to keep fighting.
Thank you so much for the
All right.
support and the opportunity to share my story.
Oh, you're so, so welcome.